Hello and welcome to Mind Creations. After viewing this video you will know a little more about schizophrenia. What is schizophrenia? Schizophrenia is a serious mental disorder characterized by a disconnection from reality, often manifesting as delusions, hallucinations, and disordered thinking and behavior. It is a chronic condition that typically develops in the late teen or early adult years and can have a significant impact on a person's daily life. Symptoms of schizophrenia can vary widely and may include disordered thinking, confused speech, auditory hallucinations, delusions, and disorganized behavior. The exact cause of schizophrenia is not known, but it is believed to involve a combination of genetic, environmental, and neurobiological factors. Types of schizophrenia. There are several subtypes of schizophrenia, which are characterized by specific patterns of symptoms. Some of the most common subtypes of schizophrenia include 1. Paranoid schizophrenia. This subtype is characterized by the presence of delusions and auditory hallucinations, but relatively clear thinking and good functioning in other areas. 2. Disorganized schizophrenia. This subtype is characterized by disordered thinking, disorganized speech, and disorganized behavior. 3. Catatonic schizophrenia. This subtype is characterized by motor disturbances, such as stupor, rigidity, or excessive movement. 4. Undifferentiated schizophrenia. This subtype is characterized by symptoms that do not fit into any of the other subtypes. 5. Residual schizophrenia. This subtype is characterized by the presence of negative symptoms, such as apathy and social withdrawal, but without the presence of active positive symptoms, delusions, hallucinations, disordered thinking, disorganized behavior. It's important to note that these subtypes are not mutually exclusive, and individuals may experience symptoms from more than one subtype. Also, the diagnostic criteria and classification of schizophrenia are continuously evolving, so the subtypes may change over time. The symptoms of schizophrenia can be broadly divided into two categories: positive symptoms and negative symptoms. Positive symptoms are those that reflect an excess or distortion of normal functions, and include delusions, false beliefs, often of persecution or grandeur; hallucinations, seeing, hearing, smelling, or feeling things that aren't there; disordered thinking and speech, difficulty organizing thoughts, jumping between unrelated topics, or making up meaningless words or phrases; agitation and disorganized behavior, behaving in a way that is inappropriate for the situation, such as laughing at a funeral, or having trouble completing everyday tasks. Negative symptoms are those that reflect a diminution or loss of normal functions, and include loss of motivation or interest in daily activities, reduced emotional expression, difficulty in initiating and maintaining social interactions, lack of pleasure or enjoyment in life, difficulty in expressing oneself, or understanding spoken or written language, difficulty in making decisions, or planning for the future. It's important to note that the symptoms of schizophrenia can vary widely from person to person, and can change over time. Some people may have mild symptoms, while others may have severe symptoms that significantly disrupt their daily lives. How can the schizophrenia be controlled? Schizophrenia is a chronic condition, and managing it typically involves a combination of medication and therapy. Medications, antipsychotic medications are the mainstay of treatment for schizophrenia. These medications work by altering the levels of certain neurotransmitters in the brain, which can help to reduce the severity of positive symptoms such as delusions and hallucinations. Antipsychotics can have side effects, such as weight gain, drowsiness, and movement disorders, so it's important to work closely with a healthcare provider to find the right medication and dosage. Therapy. In addition to medication, therapy can also be helpful in managing the symptoms of schizophrenia. Some of the most common therapies include cognitive behavioral therapy, CBT. This type of therapy can help individuals learn to recognize and challenge delusional thoughts, and improve coping skills. Family therapy. This type of therapy can help families understand the illness and learn how to support the person with schizophrenia. Vocational rehabilitation. This type of therapy can help individuals with schizophrenia learn the skills they need to find and keep a job. Social skills training. This type of therapy can help individuals with schizophrenia learn the skills they need to interact with others more effectively. Self-help measures. In addition to therapy and medication, there are a number of self-help measures that can help individuals with schizophrenia manage their symptoms. Some of these include sticking to a regular routine, getting enough sleep, eating a healthy diet, avoiding drugs and alcohol, exercising regularly, practicing relaxation techniques like yoga and meditation. It's important to note that each person's experience with schizophrenia is unique, and what works for one person may not work for another. Treatment plans should be tailored to the individual's specific needs and preferences. Can schizophrenia be cured? Schizophrenia is a chronic condition and currently, there is no known cure. While antipsychotic medications can help to reduce the severity of symptoms, they do not eliminate them entirely. Schizophrenia is a chronic condition that requires ongoing treatment and management. With the right treatment and support, many people with schizophrenia are able to lead fulfilling and productive lives. The goal of treatment is typically to reduce symptoms, improve functioning, and prevent relapses. It is important to note that recovery is a unique and personal process for each individual, and can take some time. It's also important to keep in mind that the process of recovery is not a linear one, and people may experience setbacks or relapses along the way. With the right treatment and support, however, many people with schizophrenia are able to achieve a good quality